This mini-documentary explores the impacts of sexual minority status on health. Those of a sexual minority may include homosexual, pansexual, bisexual, intersex, transgender, genderqueer, non-binary, or asexual people. Where this is an expansive definition, it may be clearer to define what the sexual majority is, as cisgender, heterosexual people. People of a sexual minority in the United States deal with stressors due to their perception, also called heterosexism. Those of a sexual minority may feel pressure to conform to the majority, along with identity-based discrimination and difficulty with acceptance in interpersonal relationships such as family. For people of a sexual minority, the cultural and medical narratives may create barriers to social status and therefore less chance of success in terms of health. Intersex and transgender individuals who have medically transitioned may not fit into a sex category and therefore have medical analysis inaccurate to their health. Transgender people continue to be pathologized, and the medical field historically diagnosed homosexuality as a mental illness. Current media promotes ideas of trans people as mentally ill due to their gender identity and expression. Those of a sexual minority may experience bias in a medical setting, leading to negative health outcomes.
Okay, even I got top surgery over the summer. The whole time, everyone was misgendering me, and I'm literally here to get tops. I'm literally getting, so I don't know. And then it's, just accessing hormones is really difficult.
I don't know, just in those spaces, I feel like it's required of me to be normal, for me to have, normal relations with people, and yeah.
They're just, trying to, I don't know, explain my identity, but I feel like my care was still or my physician was still understanding that, and it just changed how when we talked about different things.
When I got to the doctor, he looked over my chart, saw that my heart was stopping, and told me that I was fine and that there was nothing wrong with me.
I definitely feel like doctors don't listen to me, and that I feel very talked down to, but it's hard to say if that's the reason or if they're just like that.
And so after that, my journey of trying to figure out what is going on with my heart kind of halted. It definitely discouraged me. It was incredibly discouraging.
So I did receive some interesting questions from the doctor that was I don't think you fully understand what I'm doing in my private life. Based on your line of questioning, it seems like you're unaware of what this looks like. But otherwise, I think it was just probably just general ignorance rather than medical malicious treatment or something.
And I just feel like in those spaces, in those mental health spaces, I can't really talk about my gender dysphoria, how it feels being queer and just so separated from everyone else and just being considered different.
I feel like the doctor is really weird about queer people and stuff, but it's hard to put my finger on it because it's you can't just prove that that's why someone is talking to you a certain way.
Okay, I did go to a clinic twice for sexual health reasons, and the only problem I had was with payment. It was supposed to be a free clinic, but I've been charged, so. Getting shouted at from people driving in their cars, or even just in public. But yeah, several instances of, verbal harassment.
Certain looks, certain comments especially. I receive homophobic comments when I'm working. They're gonna take one look and see they're not fit for this job, and my entire future just might fall apart just because of who I am. I have lost most of my family. I have cut off my direct family. I don't talk to my brother or my sister. But it's very scary thinking about my extended family and my sexual orientation.
I mean, I'm mostly in queer spaces. I feel very isolated from regular society, so I kind of stick to queer spaces because I feel in my classes and stuff, people my teachers don't want to call on me, people don't want to people are off put or something. I don't know.
And I don't go outside. I don't go into public spaces all too much where I don't know that like it's a safe place. I'm very secluded.
Or at least in the past year, I've been surrounding myself with people who like respect my identity and like who also might share like common identities.
My friend group was primarily of the community.
According to these interviews, people of a sexual minority report social stigmas and perceptions, leading to ostracization, erasure, and abuses, experiencing making themselves smaller and only employing spaces designed for them. Experiences of stress, minimization, and ignorance were highlighted in healthcare spaces. Surrounding themselves with other queer folks serves as a means to create hope through community. Through widespread education and community support, I believe we can change this narrative for those of sexual minorities.